Those lumps you feel along your child's neck may or may not be anything concerning. If you've never felt your child's neck before, I usually recommend feeling once in a while so you can see what their baseline is and you can tell what the difference is if anything changes. I'm Dr. Nkirike, board certified pediatrician and pediatric uro doctor, and in this video we're going to be talking all about lymph nodes, what they are, what is considered normal, and what makes them get bigger. What you should do at home, as well as red flag symptoms you watch out for to get them checked out as soon as possible. So while there are a lot of lumps that can occur around the neck and could be anything, today I'm focusing only on lymph nodes in particular. Lymph nodes are part of a bigger system, which is what we call the lymphatic system. They basically act as filters that filter germs and harmful substances that come into our body. I like to think about the whole lymphatic system as a flow of soldiers with special white cells called lymphocytes that are there to help your body fight infection. So as part of our wonderful immune system, when we get sick, these nodes, which are soldiers, get activated because now they're doing a lot of work filtering germs and substances coming into our bodies. So that's the reason why when it comes to kids, because kids are constantly sick, their nodes tend to get bigger, may stay on for a longer period of time compared to adults because they're always actively fighting an infection and their lymph nodes are constantly filtering. Even though the lymph nodes around the neck are the ones that are more noticeable and felt more, lymph nodes can occur in different parts of the body. You may notice them in the armpit, which is the axilla. You may notice in the groin and the belly, just about different places. It depends on where the infection or the germ your body is fighting tends to be at that time. What can make your lymph node get bigger? What type of infection might make your lymph node get bigger? First of all, lymph nodes get bigger based on the location they are draining. For instance, if your child has an infected ringworm on the head, you may notice lymph nodes at the back of the neck or at the back of the base of the head start to get bigger and more uncomfortable. If your child has a runny nose, a cough, or maybe even a sore throat, you may notice lymph nodes around the neck get bigger. On the other hand, if your child has any cuts or rashes or anything down the legs, you may notice the lymph nodes around the groin start to get bigger because that's where those lymph nodes tend to drain. The most common reason that kids' lymph nodes get bigger are viruses. I know. The constant runny nose and the sore throat keep making their lymph nodes around the neck get bigger. Other reasons that bacterial infection like the strep, the ear infections may also make your child's lymph nodes get a little bigger because they're still germs that your child is fighting. Cavities, dental abscesses might make lymph nodes around the jaw get bigger because now they're draining and trying to trap infections in that area. Bacterial skin rashes like impetigo or even infected ringworms can also make lymph nodes in your body get bigger or in your child's body get bigger. One of the most forgotten ones is cat scratch. Are more likely to scratch kids because you're always playing with them and you may not even notice the scratch at the time. But your child may subsequently develop lymph nodes that are bigger, which we call lymphadenopathy, which is due to that cat scratch. So if your child comes into the ER or comes to see a regular physician because you're noticing a lymph node and you have a cat or a kitten, we always want to know. So we recommend you telling us about any pet you have in the house to help us know if that's the reason why your child has a lymph node that's bigger at the time, and we can know how else to evaluate. Certain medications and certain rheumatologic diseases can also cause lymph nodes to get bigger and matted. And of course, towards the end of the spectrum is one thing we're usually concerned about when we talk about lymph nodes getting bigger, and this is cancer. And we're going to talk about more about that and how to recognize some symptoms of it when we talk about red flags. What do normal lymph nodes feel like? You're feeling and touching, you're wondering, what am I even feeling for? So in their normal state, kids may or may not have any active lymph nodes. You may not even feel any lumps in the neck. But this is very uncommon because kids are constantly sick and filtering one thing or the other. So your child is more likely to feel some smaller nodes on the sides. Most lymph nodes, whether reactive or small, are more likely to be less than 1.5 cm, and that's the size of a pea or of a baked beans. They're usually rubbery and they move around whenever you touch them. They're not stuck together. They usually move around under the skin, and that's typically normal. It may or may not be painful depending on if your child is actively fighting an infection or it's resolving. If your child had a cold a few weeks ago, it's more likely a reactive lymph node that's yet to resolve, and they may not be uncomfortable. If your child, however, has an active infection going on, it's not uncommon for them to feel a little bit of discomfort when they touch the lymph node. Normal lymph nodes also tend to get bigger during an active infection, whether viral, and they tend to resolve within 3 to 4 weeks of your child getting sick. But because kids are constantly sick again, like I mentioned, it's not uncommon for them to shrink and become smaller, but not totally disappear and just stay there as your child continues to grow. So it is difficult to differentiate if this lymph node that's bigger is caused from a viral infection versus not. But here are some suggestions that might make you think it's more from a viral infection. One, if your child has an active cough and cold and runny nose and sore throat, the usual things that kids always have, and you're noticing all those things, it may just be a viral reaction from the active lymph node. If your child is comfortable comfortable, running around, does not seem to be in distress. It may just be viral. If your child lymph node is there and doesn't disturb them from moving the neck from side to side, seems to shrink and start to disappear when the viral infection is resolving, it may just also necessarily be from the virus and nothing else serious going on. Lymph nodes from a viral infection may also tend to be on both sides of the neck versus one, but it still depends on the location that it's draining. They are typically less than 1.5 cm, which is the size of a baked beans or pea, and they're not larger than that. If, on the other hand, your child tends to have bigger lymph nodes that are disturbing, then I want you to think about these red flags that I'm going to discuss right now. When should you be concerned about your child's lymph nodes or the lump you're seeing on the neck? So I want you to know this just to give you an idea so you can tell when to seek care. Number one, if your child has a lymph nodes that's larger than a quarter, about a quarter size, or even a dime size, I always recommend to get that checked out. If your child's lymph nodes is stuck together, you're feeling the lumps, they're not rubbering and moving under the skin, they're stuck together, or they're causing your child discomfort when they turn their neck from side to side, or when they move based on where the location is. These are definitely nodes we want to get checked. Other red flags we're concerned about are daily fevers lasting 5 days and more, or maybe your child is waking up drenched in sweat, so night sweats, they wake up and the whole bed is soaked, or your child is losing weight, decreased appetite, just generalized fussy, and they're not comfortable, or anything else you're concerned about occurring also with the lymph node. If your child is having increased lymph nodes, swollen lymph nodes, uncomfortable lymph nodes, and easy bleeding and bruising, these are usual red flags that we're highly concerned about. It may just not be related to an infection, but it may be something we're always worried about to make sure there's no cancers or blood malignancies that we need to evaluate for. How do we generally treat lymph nodes? First of all, I want you to remember a lot of these lymph nodes are a reaction from an infection like a viral or bacterial infection going on, and they're usually mild and treatable. When you bring your child in for an evaluation for lymph nodes, either to a regular physician or the ER, we ask a lot of questions, and these questions are helping us diagnose or see what the cause is. We ask how long they've been there. Does your child have any other symptoms? Are they tired? Are they having fevers? Do they have any weight loss? So this kind of helps direct us in the location or in the idea to know what to think. We also ask about pets, which is why I talked about Cat's disease being a common reason why kids can have swollen or infected lymph nodes. And of course, we examine the lymph nodes. We're examining for the size, if it's painful, is it moving under the skin, just to get an assessment of if this is a normal lymph node or if it's deviated from what we usually consider normal and something we may be concerned about. If after the history and examination we think this is more from an ongoing viral infection or a resolving viral infection, it's not uncommon for us to recommend you observe at home for the next 3 to 4 weeks and see if these lymph nodes shrink and even disappear. Viral lymph nodes tend to disappear when the ongoing viral infections start to resolve. And even because kids tend to get sick over and over again, they may not completely disappear. We expect them to get smaller. So while we reassure you and send you home, we always say follow up with your regular physician in 2 to 3 weeks for them to re-examine and see what the size is and see if it's getting better or worse. If we think the swelling is more from a bacterial infection, we may give you antibiotics and also recommend you follow up with your regular physician within the next week or 2. The reason is a lymph node from a bacterial infection or a lymph node that's infected itself, they usually respond to antibiotics and start to shrink and get smaller. And if your child was having fevers due to that, they should start getting better. And if it's not within that 1 to 2 weeks, of course, we want to evaluate them more. On the spectrum of bacterial infections, if we think it's more from a cat scratch, we tend to draw titers first for the bacteria called Bartonella before we consider either following up to treat or to wait till that comes back. Cat scratch disease is technically sometimes treated differently with different antibiotics, but we may not necessarily jump into that unless the titer comes back. If we think on examination your child's lymph node actually appears big, but they have no active infection going on, or they have any of the red flag symptoms I mentioned before, we tend to do more. Typically, we start with ultrasounds. Ultrasounds are just non-invasive, which means they may not necessarily bother your child. And we're looking to see what's the size of this lymph node. What do they look like? Are they actually stuck together? Or they're just a huge number of multiple lymph nodes just around each other? Does it contain any fluids? Is it look infected, having a pus inside? Or is it necrose, which means technically going dead and needs antibiotics to be treated? So ultrasound is usually the first step that we go to help us evaluate these lymph nodes. After an ultrasound, based on what we see, we may consider doing a chest x-ray. When we have red flag symptoms and we're worried about multiple lymph nodes, we tend to look at the lung to see if there are lymph nodes in the lungs that are also bigger or if there's any metastasis to the lungs in cases of cancer. Blood testing and lab work is also another consideration that we do when we're concerned about lymph nodes and red flags. And in the blood test, we're not only looking for markers for infection, we're also looking for markers For blood malignancies, you may notice the red blood cells being too low, which means the child is anemic. You may notice the clotting factors like the platelets being significantly low, but we may notice that the white cells may be super high, as in the case of leukemias and other blood cancer. In the blood testing, this is also when we consider and do Bartonella testing if you have a cat or any exposures to cats that may have caused a cat scratch disease. So while we don't do lab tests or blood tests for everyone, we usually consider a lot in situations where we're worried about red flags with their lymph nodes. So management of lymph nodes can vary a lot, from observation at home, following up with your regular physician, referring to either and through a doctor's infection specialist for continuing follow-up of the lymph nodes, or even admitting your child to the hospital if we're concerned about the lymph node and the blood tests to make sure we're giving your child the best care and treatment that they need at that time. Now, I talked a lot about lymph nodes. Now we're going to do a quick rundown summary of things I want you to remember. Number one, a lot of babies and kids have lymph nodes and swollen lymph nodes around their neck and maybe the axilla. It just depends on the location of the infection they have at the time. I want you to feel your child's neck today and feel them once in a while to get what their baseline is so you can tell the difference if anything changes. A lot of them that are associated with a viral infection tend to get big and shrink within 3 to 4 weeks of the infection they're having. But it's not uncommon for kids to have lymph nodes that technically stay big because they continue to have repeated infection, and that's also normal. Know the red flag symptoms and know when to get your child seen. I want you to be reassured that a lot of these lymph nodes are benign, but I also don't want you to miss anything and your child get progressed illness before you come in or get seen by your regular physician. I want you to go feel your child's lymph node today and come back and let me know how they feel if there's anything you're concerned about. Again, don't forget to like and subscribe, and I will see you in the next video.